Hey everyone, and welcome back for another deep dive.
Yes.
Today, we're going to be taking a closer look at
Okay.
communication and interpersonal skills in nursing,
Sounds good.
or CPIS, as you might hear it called sometimes.
Right.
So CPIS, we've got a ton of research here.
Okay.
Really fascinating stuff, actually.
Yeah.
A lot of insights from psychology and sociology,
Uh-huh.
all about how to build stronger connections with your patients.
Yeah, it's really fascinating how CPs in nursing,
Yeah.
it goes way beyond just, exchanging information.
It really does.
It really gets at the heart of caring for another person.
Yeah, and it's about understanding
Right.
their needs,
Absolutely.
building that trust,
Absolutely.
and advocating for them even when things get tough.
Yes. And speaking of tough,
Yeah.
one scenario from the material that really stood out to me
Okay.
was about Jenny, the student nurse.
Oh, yeah, Jenny.
Remember, she noticed a patient
Uh-huh.
getting visibly upset during a family visit.
Yeah, she was hesitant to step in.
And that's a great example of how CSAMBES is tied to those
Yeah.
core nursing values.
Exactly.
So Jenny felt unsure of herself,
Right.
worried about appearing incompetent
Yeah.
to her senior colleagues.
Makes sense.
So she prioritized those routine tasks over the patient's well-being.
And really recognizing and responding to a patient's distress is a crucial part of care.
Absolutely. It's all about providing dignified, patient-focused care.
Okay, so effective CSAPs requires us to step outside our comfort zones sometimes,
Yes.
even when it's awkward or challenging.
Yes.
Now, the material mentions a circular transactional framework.
Okay.
Can you break that down for us?
Oh, of course.
This is about communication in those complex situations.
Right. Think of it like this every time you communicate with a patient.
Yeah.
It's not just you sending a message and them receiving it.
Right.
It's a two-way street,
Okay.
lots of factors at play.
Uh-huh.
You have the sender, the receiver, the message itself,
Got it.
the way it's delivered face-to-face, a note, whatever.
The camo.
It's the space you're in, the whole context.
So even if you explain something super clearly,
Yes.
the patient's emotional state or their past experiences,
Right.
even the environment could affect how they understand.
Exactly. And that's why strong SIPes requires you to be
Yeah.
really attuned to all those elements, not just the words.
Wow.
It's about recognizing that communication is influenced by things
Oh.
we might not even be consciously aware of.
That makes a lot of sense.
Good.
Speaking of things we might not always be aware of,
Yes.
there was this concept of psychological care.
Right.
I found that super interesting.
Uh-huh.
What does that mean in the context of nursing?
Well, psychological care goes beyond just the medical tasks,
Okay.
like taking vitals, administering medication, things like that.
Yeah, the routine stuff.
Exactly. It's about recognizing and addressing the
Yeah.
emotional, social, and even spiritual needs of each patient.
So it's about seeing them as a whole person.
Yes, not just a set of symptoms.
I love that. Treating the person, not the disease.
Exactly. And research has shown that this kind of care
Uh-huh.
has some key characteristics.
Okay.
It's effective, meaning it actually makes a difference in a patient's experience.
I like that.
It's continuous. You weave it into every interaction.
Okay.
It often involves invisible care.
Invisible care?
Yes, like noticing a patient's subtle cues or providing emotional support.
So you're saying it's not just about being nice.
No.
It's about a skillful, intentional approach to care that considers the whole person.
Absolutely. It's about building a dynamic, individualized relationship.
Do you have an example
Sure.
of how this might play out?
Absolutely. One of the sources described a community nurse
Okay.
who had been visiting a patient for quite a while.
Uh-huh.
On the surface, everything seemed fine,
Okay.
but the nurse had this gut feeling that something was bothering the patient.
Interesting.
Even though there were no obvious signs, she decided to trust her intuition.
Wow. So she went beyond the routine checkup
Yes.
and relied on that established relationship to tune into what the patient was saying out loud.
Exactly. And because of that, the patient felt comfortable enough to open up.
Okay.
It turned out her husband had recently become ill and she'd been keeping all her worries bottled up.
Oh, wow.
That nurse's willingness to provide psychological care created a safe space
Yeah.
for the patient to share her burden and receive the support she needed.
That's such a powerful example of how CSIPes can truly impact a patient's well-being,
It is.
even in settings outside the hospital.
Yes.
It makes me wonder, when we talk about connecting with patients on this deeper level,
Yeah.
how much does empathy play a role?
Well, empathy is absolutely at the heart of effective CSITEs.
Okay.
And it's so much more than just feeling sorry for someone.
Right.
It's a skill.
It's a skill.
Yes, a way of understanding and responding to another person's emotional experience.
I think a lot of people just assume you're either an empathetic person or you're not.
Right.
But you're saying it's something we can actually learn and improve upon.
Absolutely. Like any skill, it takes practice and intention.
Okay.
One concept that helps illustrate this is empathic attunement.
Empathic attunement.
Yes, it highlights the importance of nonverbal communication,
Uh-huh.
especially your facial expressions in conveying genuine care and understanding.
So it's not just what you say, but how you say it.
Exactly. Your body language, your tone of voice,
Right.
those can communicate volumes.
Have you ever had like someone try to comfort you,
Yes.
but their facial expressions seemed detached or insincere?
Oh, yeah.
Do their words really resonate?
No. Okay.
It's like their body language betrayed their true feelings.
That's the power of empathic attunement.
Wow.
When your words and nonverbals are aligned,
Okay.
you create a sense of authenticity and trust, which is essential in any nurse-patient relationship.
Right.
There's a case study in the material that really brings this to life.
Okay.
It describes a nurse listening to a patient sharing a very personal, emotional story.
Oh, I think I remember that one.
Yeah,
Instead of just politely nodding along, the nurse allowed her facial expressions to mirror the patient's emotions.
exactly.
It's like she was saying, I see you, I hear you, I feel you, without actually speaking the words.
And that level of empathy creates a safe space for vulnerability.
Yeah,
The patient feels seen, understood,
right.
and that can be incredibly powerful in their healing journey.
It's amazing how much impact a nurse's empathy can have.
It is.
But I imagine maintaining that level of connection within a busy,
Right.
sometimes chaotic hospital environment
Yes,
could be really challenging.
you're absolutely right. And one of the biggest challenges comes from the structure
Okay.
of healthcare organizations themselves.
Okay, so this is where it gets a bit more complex.
It does.
Help us understand how those organizational structures can hinder good communication and interpersonal skills.
Well, think of it this way.
Okay,
Organizations have two sides.
two sides.
Yes, the rational and the irrational.
What do you mean by that?
Well, the rational side is all about systems, procedures, efficiency. Right.
Those measurable things.
Makes sense.
But organizations are also made up of people,
True.
and people are driven by emotions, anxieties, even unconscious motivations.
Right.
That's the irrational side.
So sometimes the human element and the organizational structure clash.
Exactly. And there's a theory that organizations often use defense mechanisms.
Defense mechanisms.
Yes, to manage anxiety.
Interesting.
They might have rigid rules, prioritize tasks over relationships, or even downplay the emotional aspects of care.
So can you give a concrete example of how this might impact nurses' ability to provide good CPs?
Sure, one example that stuck with me was about a nurse who kept rearranging chairs.
Rearranging chairs?
Yeah, in a common area to encourage patients to interact with each other.
Oh, that's so thoughtful.
It was a small gesture, but she was trying to create a more welcoming social atmosphere.
So what happened?
Well, the cleaning staff kept moving the chairs back to their original positions
Oh, no.
against the wall.
Really?
It turned out that this was easier for them to clean.
And they cited health and safety concerns.
So even with the best intentions, this nurse's efforts were thwarted
Yes.
by the ingrained practices of the organization.
Unfortunately.
It's almost like the system itself was resisting the idea of patients connecting with each other on a deeper level.
It's a fascinating dynamic, isn't it?
It is.
It illustrates how seemingly small things like the arrangement of furniture
Right.
can reflect a deeper organizational culture
Interesting.
that prioritizes efficiency and control over patient well-being and connection.
It's almost like nurses need X-ray vision
I love that analogy.
to see beyond those surface-level practices.
It's about recognizing
Right.
those subtle but powerful dynamics that are always at play.
Absolutely.
Good.
And speaking of dynamics, it occurs to me that we also need to consider
Yes.
the incredibly diverse patient populations nurses encounter.
Of course.
Each age group, from children to older adults, comes with its own unique set of communication challenges and considerations.
That's a great point.
Where do we even begin with such a broad range of needs?
Let's start with children.
Okay, children.
We know clear communication is essential in any healthcare setting,
Yes,
but with children, it's especially crucial.
right, because they might not have the vocabulary or cognitive ability to understand.
Exactly.
It must require a whole other level of patience and sensitivity.
You can't expect a toddler to understand complex medical jargon.
Right.
Developmentally appropriate language is key.
So important.
And research has shown that teaching children how to communicate with healthcare professionals actually improves their overall experience.
Wow. So empowering children to effectively communicate their needs leads to better care.
It does.
What about adolescence?
Adolescence.
That's such a unique stage of life.
It is.
I imagine they present their own set of communication challenges.
Absolutely. Adolescence is a time of huge physical, emotional, and social change.
Oh, yeah.
They're trying to figure out who they are, assert their independence,
Right.
and might be feeling extra vulnerable when dealing with illness or injury.
Okay.
Building rapport and trust is crucial.
So how do you gain their trust when they're often wary of authority figures?
Well, creating a safe space for open communication is key.
Okay.
That might mean giving them some privacy to talk without their parents present,
Okay.
really listening to their concerns without interrupting,
Right.
and avoiding judgment.
So acknowledging their autonomy and giving them some control over the situation.
Exactly. It's also important to avoid making assumptions.
Right.
Just because they're young doesn't mean they haven't already faced challenges or developed coping mechanisms.
So it's about treating them as individuals
Yes.
with unique perspective.
Right. Just like any other patient.
Now let's talk about older adults.
Older adults.
They often face communication barriers too.
Yes, sometimes from healthcare providers themselves.
I've seen this firsthand with my own grandparents.
Uh-huh.
It's like some providers talk past them,
I know.
assuming they can't understand or contribute to decisions about their own care.
It's so disheartening.
It is.
It highlights the need for us to be extra mindful of our communication
Yeah,
when working with older adults.
absolutely.
Avoiding elder speak, that patronizing baby talk some people use.
It's so demeaning and disrespectful.
It is. They're adults with a lifetime of experiences and knowledge.
It's important to remember that age-related changes,
Yes.
like hearing loss or cognitive decline, can affect communication.
Absolutely. So we need to adjust our approach accordingly.
Okay,
Speaking slower, enunciating, clearly repeating information if needed.
right.
These are all small things that can make a big difference.
It's about adapting to their needs,
Yes.
not expecting them to adapt to ours.
Right.
And even when there is cognitive decline,
Mm-hmm.
we should never assume they can't understand or participate in their care.
Absolutely. Involving them in decisions whenever possible and treating them with dignity and respect
Right.
should always be top of mind.
It's all about seeing the person behind the age,
Yes.
recognizing their individuality and honoring their life experiences.
Exactly.
Now, we've been talking about these diverse populations,
Right.
but it strikes me that cultural differences can also play a huge role
Absolutely.
in how people communicate and perceive healthcare.
You're absolutely right.
We live in an increasingly multicultural world,
We do.
and that's reflected in healthcare settings too.
Absolutely.
So nurses need to be culturally aware and sensitive in their communication.
It's no longer enough to just have good intentions.
Right. We need a deeper understanding of how culture shapes communication.
Exactly. That's where concepts like cultural preservation, negotiation, and repatterning come in.
Those sound intriguing, but I'm not quite sure what they mean.
Okay.
Can you break those down for us?
Of course, cultural preservation is about acknowledging and respecting a patient's cultural beliefs and practices.
Even if they differ from your own?
Even if they differ from your own, it's about finding ways to incorporate those beliefs into their care plan whenever possible.
So it's about honoring their cultural identity within the healthcare context.
Right, and then there's cultural negotiation,
Okay.
which becomes important when a patient's cultural beliefs clash with recommended medical treatments.
I can imagine those conversations require a lot of sensitivity.
Absolutely. It's about finding that delicate balance.
Yeah.
A compromise that honors both perspectives.
And finally, cultural repatterning.
Yes, this comes in when a patient's cultural practices might actually be harmful to their health.
So it's about education and collaboration, not judgment or coercion.
Precisely. It involves working with the patient to help them understand the risks
Okay.
and finding alternative practices that are both culturally acceptable and health promoting.
Got it. It's all about approaching these situations with cultural relativism.
Yes, remembering that no culture is inherently superior or inferior to another.
Right?
Each culture has its own unique set of values and beliefs.
Right.
And we need to approach those differences with respect and an open mind.
So shifting our perspective and recognizing that our own cultural lens isn't the only way of seeing the world.
Exactly. And that brings us to the work of Madeline Leininger.
Madeline Leinen.
Yes, who developed the theory of transcultural nursing?
I've heard her name before. Can you tell us more about her theory?
Sure. Leininger believed that understanding and respecting a patient's cultural background was essential
Okay.
for providing effective, compassionate care.
Okay.
She emphasized the need for nurses to be culturally competent,
Culturally competent.
which involves not just awareness of cultural differences,
Uh-huh.
but the ability to adapt your care practices to meet the needs of diverse patients.
So it's not enough to simply be aware of differences.
Right.
You have to actively incorporate that understanding into your interactions and care plans.
Exactly. Her theory offers practical guidance on how to assess a patient's cultural background,
Okay.
identify potential areas of conflict or misunderstanding,
Uh-huh.
and bridge those cultural gaps in communication.
This is all so incredibly insightful.
Good.
We're really peeling back the layers of SEEPs
Yes.
and revealing just how complex and nuanced it is to truly connect with patients on a human level.
It is.
But with all this talk about theory and concepts,
Uh-huh.
I'm wondering how nurses can put these ideas into practice.
Right.
How do we go beyond intellectual understanding and actually embody SEEPs in our daily interactions?
That's the million-dollar question.
Right?
And it brings us to a crucial aspect of nursing lifelong learning.
Okay, so it's not something you just learn in school and then check off your list.
Definitely not. Healthcare is constantly evolving, communication practices change,
Right.
and nurses need to be committed to continuous learning, especially when it comes to SEEPs.
So how do we do that?
Well, one of the most powerful tools is reflective practice.
Reflective practice.
Yes, taking time to reflect on your interactions with
The
patients.
good old stop and think approach.
Exactly, to analyze what went well, what could be improved,
Mhm.
and how your own biases or assumptions might have influenced the encounter.
So it's about developing self-awareness and understanding how your own thoughts, feelings, and experiences shape your communication.
Right. Another strategy is seeking feedback.
Ooh, that can be tough, but so beneficial.
It can be, but asking colleagues or even patients for honest feedback on your communication style can be so illuminating.
It can be hard to hear sometimes.
It can, but it helps you identify blind spots in areas where you can grow.
It's about being open to constructive criticism, understanding that we can always learn and improve.
Yes, and of course, staying updated on new technologies and communication approaches is crucial.
Especially in today's world,
Yes.
where technology changes how we interact and access information so rapidly.
Absolutely. Nurses need to be comfortable using new communication platforms.
Right.
Whether it's video conferencing with patients utilizing online resources,
Mm-hmm.
or even navigating social media to share health information responsibly.
So it's about being adaptable and embracing those new tools to enhance communication and patient care.
Exactly. And finally, I think it's important to remember that nurses can be educators too.
So it's not just about absorbing knowledge,
Right.
but sharing it as well.
You can share your knowledge and skills with colleagues,
Okay.
mentor newer nurses,
Mm-hmm.
lead workshops, or even educate patients on how to better communicate their needs.
So it's about creating that culture of learning and collaboration.
Precisely. And that's really what SITS is all about, creating connections, fostering understanding, and advocating for compassionate and individualized care.
It really does feel like all these pieces, empathy, culture, the healthcare system itself, they all weave together to impact how we communicate with patients. It's complex.
It is. And speaking of complexity, one thing that really stood out to me in the material
Okay.
was how much our own social identities and biases
Oh, yeah.
can influence our communication sometimes without us even realizing it.
You're talking about those unconscious biases we all carry around.
Exactly, the ones that shape how we perceive and interact with the world.
Yeah.
Everyone has these mental frameworks
Okay.
called schemas
Schemas.
that help us make sense of information quickly. They're based on our past experiences, cultural background, values, and beliefs.
So they can be helpful, but
They can, but sometimes they lead to stereotypes and generalizations,
Right.
which can impact how we communicate with patients.
so can you give an example of how that might show up in a nursing setting?
Sure, let's say you're caring for a patient from a different cultural background than your own.
Okay.
Without even realizing it, you might make assumptions about their understanding
Uh-huh.
of medical procedures or their willingness to follow certain treatments based solely on their cultural background.
So you might unintentionally misinterpret their behavior or communication style
Right.
based on those preconceived notions.
And that can lead to miscommunication, mistrust,
Yeah.
and ultimately negatively impact the patient's care.
That makes sense. The material highlights this concept of cultural humility
Yes.
as a way to counteract these biases.
Right.
Cultural humility. Tell me more about that.
Well, it's about approaching each patient with a sense of openness
Okay.
and a willingness to learn about their unique experiences and perspectives.
Okay.
It's about recognizing that you don't have all the answers
Uh-huh.
and that the patient is the expert on their own life and culture.
So it's about being curious, asking questions, and actively listening to understand the patient's perspective
Exactly.
rather than imposing your own assumptions.
Right. It's also about acknowledging the power imbalances
Okay.
that can exist in the healthcare setting.
Right.
Patients often feel vulnerable and might hesitate to speak up or challenge their providers.
That's such an important point. As nurses, we hold a position of authority,
We do.
and that can make it even more crucial for us to be mindful of how we communicate
Absolutely.
and to create a space where patients feel safe to express themselves honestly.
Absolutely. And all of this is connected to this idea of balancing emotions.
Balancing emotion.
Yes, in the nurse-patient relationship.
Okay.
The material emphasized how challenging it can be for nurses to navigate their own emotional responses,
Yeah.
especially when dealing with difficult situations.
Yeah. If you imagine you're dealing with patients who are in pain, facing uncertainty,
Right.
and going through incredibly challenging experiences. It must be tough to not get emotionally overwhelmed at times.
It is, and nurses are often socialized to be caretakers and helpers,
Right.
which can make it even harder to set boundaries and prioritize their own emotional well-being.
So how do you find that balance? How do you stay present and empathetic for your patients without letting their emotions completely drain you?
Well, one strategy is practicing self-awareness.
Okay.
Pay attention to your own emotional responses,
Uh-huh.
your triggers and your limits.
Right.
Recognize when you need to step back and take care of yourself.
Makes sense.
Whether that means taking a break, talking to a colleague, or engaging in self-care activities outside of work.
It's like saying go. You can't pour from an empty cup. Nurses need to replenish their own emotional reserves in order to provide compassionate care to others.
Exactly. And self-reflection is also key.
Self-reflection.
Yes, taking the time to process your experiences,
Okay.
to analyze how you handled challenging situations,
Yeah.
and to identify areas where you can improve your communication and emotional regulation skills.
So it's about that continuous learning and professional development we talked about earlier.
Absolutely. It's not something you just master overnight.
Right.
It's an ongoing journey.
And one of the sources talked about the importance of building a supportive network
Yes.
of colleagues, mentors, or even therapists who you can talk to about your experiences and challenges.
It's about recognizing that you don't have to go through it alone.
Right. Having a supportive community can make a huge difference in your ability to navigate those emotional
It
complexities
can.
and provide the best possible care for your patients.
Right. And remember, effective communication and strong interpersonal skills are essential for building trust and rapport
Yeah.
with your patients.
It's at the foundation of a strong nurse-patient relationship,
It is.
which ultimately leads to better outcomes and more positive experiences for everyone involved.
Exactly. When patients feel heard, understood, and respected,
Right.
they're more likely to engage in their care, adhere to treatment plans, and feel empowered to advocate for their own needs.
And as nurses, we feel more fulfilled and satisfied when we can connect with our patients on that human level,
Absolutely.
knowing that we're making a real difference in their lives.
It really does highlight how important SEEKS is in the overall context of nursing.
Speaking of context, it occurs to me that communication can be affected by factors
Yes.
beyond the individual nurse and patient.
Of course.
The healthcare system itself, with all its rules and regulations, can sometimes create barriers to effective SEEPs, right?
You're absolutely right. We've already talked about how organizational structures can sometimes prioritize efficiency over relationship building,
Yeah.
but there are also more specific challenges nurses face on a daily basis.
Like what? What are some examples of those challenges and barriers?
Well, think about time constraints.
Time constraints.
Nurses are often juggling multiple patients, demanding tasks, and ever-changing priorities.
Yeah, it sounds stressful.
It can be difficult to find the time for those meaningful conversations
Right.
and to really listen attentively to each patient's concerns.
Yeah, I could see how feeling rushed and pressured could really impact your ability to be fully present and engage in those deeper levels of communication.
Exactly. And then there's the issue of documentation.
Documentation.
So much of a nurse's time is spent charting, updating records, and fulfilling administrative tasks.
Oof, it never ends.
It can feel like you're constantly being pulled away from direct patient care.
It's almost like the system itself is competing for your attention,
Right.
making it harder to prioritize those face-to-face interactions.
Right. And then there are the challenges that come with communicating with other healthcare professionals.
Communicating with colleagues.
Doctors, specialists, therapists, pharmacists, you're constantly interacting with a whole team of people.
Yep.
And sometimes communication breakdowns can occur.
It's like a relay race, and if one person drops the baton,
Right.
it can have a ripple effect throughout the entire care team.
Exactly. And those communication breakdowns can lead to errors, delays in treatment,
Right.
and ultimately compromise patient safety.
So it's not just about how you communicate with patients,
No,
but how you communicate with your colleagues as well. It's all interconnected.
absolutely. And then there's the emotional toll that comes with the job.
Yeah, the emotional toll.
Nurses are constantly exposed to suffering, loss, and difficult situations.
That's got to be hard,
It can be emotionally draining
right?
and can make it challenging to maintain those positive communication skills, especially when you're feeling stressed or burned out.
Yeah, it's almost like you need emotional armor to protect yourself
Sometimes it feels that way.
from absorbing too much of that negativity.
And that's why self-care and support systems are so crucial for nurses.
Absolutely.
You need to have healthy coping mechanisms and a network of people you can rely on
Yeah.
to help you process those difficult emotions and prevent burnout.
So it's about recognizing that your own well-being is essential for providing quality care to others.
Right. And I think it's important to acknowledge that communication isn't always easy.
It's not.
There are going to be times when miscommunications occur,
Yeah,
when conflicts arise,
of course.
and when you feel like you just didn't connect with a patient the way you hoped.
It's like any relationship, there are going to be bumps in the road.
There are.
The key is to learn from those experiences and to keep striving to improve your communication skills.
Exactly. And that brings us back to the importance of self-reflection
Yeah.
and continuous learning.
So let's shift gears and talk about some practical applications for all this amazing information we've been discussing.
Okay.
If I'm a nurse wanting to improve my SEEP skills, where do I even begin?
Well, the first step is cultivating self-awareness.
Okay, self-awareness, that sounds a bit abstract.
It does.
Can you break that down for me?
Sure. It's about paying attention to your own thoughts, feelings, and behaviors,
Okay,
especially in the context of your interactions with patients.
so it's about being mindful of how you're showing up in those moments.
Right. Ask yourself,
Okay.
what are my typical communication patterns?
Okay.
Do I tend to be more assertive or passive?
Uh-huh.
Do I listen more than I speak or vice versa?
Got it.
Think about how your own personality, background, and experiences might influence how you communicate.
So it's about understanding your own default settings,
Exactly.
those ingrained patterns that you might not even be aware of.
Right. And once you start to understand those patterns,
Yeah.
you can start to identify areas where you might want to make some adjustments.
So it's not about trying to become someone you're not, but about honing your natural strengths.
Right.
And addressing any weaknesses that might be hindering your communication.
Right. Another key aspect of self-awareness is paying attention to your emotional responses.
Emotional response.
Yes. Notice how you react in different situations.
Okay.
What triggers you? What helps you stay calm and centered? What pushes your buttons?
So it's about developing that emotional intelligence,
Exactly.
understanding how your own emotions impact your interactions with others.
Right. And remember, self-awareness is an ongoing process.
Yeah.
It's not something you achieve overnight. It's something you continually work on and refine throughout your career.
So it's like that lifelong learning mindset we've been talking about.
Exactly.
It's a journey, not a destination.
It is. Now, once you've developed a good sense of self-awareness,
Okay.
the next step is to focus on specific communication skills and techniques.
Okay, let's get practical. What are some of those key skills that every nurse should have in their toolkit?
Well, active listening is probably the most important one.
Active listening, we hear that term all the time, but what does it actually mean in practice?
It means truly focusing on what the other person is saying,
Okay.
both verbally and non-verbally.
Okay.
It's about putting aside your own thoughts and judgments and being fully present in that moment.
So it's not just about hearing the words, it's about absorbing the message,
Right.
understanding the emotions behind it,
Yes.
and responding in a way that shows you're truly engaged.
Exactly. And one of the best ways to demonstrate active listening is through nonverbal cues.
Nonverbal cues.
Yes, making eye contact, nodding your head,
Mhm.
leaning in slightly.
Huh.
These are all ways of showing that you're paying attention.
Like you're saying, I'm here with you, I'm listening, without actually speaking the words.
Right. And another important aspect of active listening is asking clarifying questions.
Clarifying question.
Yes. So instead of just assuming you understand what the patient is saying,
Uh-huh.
you're checking in to make sure you're both on the same page.
Makes sense.
You can say things like, can you tell me more about that?
Okay.
Or help me understand what you mean when you say it shows that you're truly invested in understanding their perspective.
And it helps prevent misunderstandings and misinterpretations,
It does.
which can be so crucial in a healthcare setting.
Absolutely. Another key skill is empathy,
Empathy.
which we've talked about quite a bit already.
Yeah, it's so fundamental to psychats. But how do you actually put empathy into practice?
Well,
It's not always easy to connect with patients who might be going through difficult experiences,
right.
especially if you haven't personally gone through something similar.
That's true. But remember, empathy isn't about feeling sorry for someone
Right.
or having experienced the exact same thing.
Okay.
It's about acknowledging their feelings, validating their experiences,
Uh-huh.
and showing that you care.
Well, it's about meeting them where they are emotionally speaking
Exactly.
and offering support and understanding.
Right. And one of the best ways to convey empathy is through your language.
Language.
Yes, using phrases like, that sounds really challenging, or it makes sense that you're feeling that way,
Okay.
can make a huge difference in helping the patient feel heard and validated.
So it's about reflecting their emotions back to them,
Right.
showing that you're recognizing and acknowledging their experience.
Right. And remember, sometimes the most powerful expressions of empathy are nonverbal.
Nonverbal.
Yes. A gentle touch on the arm,
Okay.
a warm smile, or simply sitting quietly with a patient who's distressed can convey more empathy than words ever could.
It's about those small gestures of kindness and compassion
Yes.
that can really make a difference in a patient's experience.
Absolutely. And another practical tip is to be mindful of your body language.
Body language.
Make sure you're facing the patient,
Okay.
maintaining appropriate eye contact, and using open and relaxed posture.
So it's about sending those nonverbal signals that you're approachable, engaged, and genuinely interested in what they have to say.
Exactly. And avoid distractions like checking your phone or looking at your watch.
Right.
Those nonverbal cues can make a patient feel unimportant
Yeah.
or like you're not fully present.
It's about giving them your undivided attention, even if it's just for a few minutes.
Right. And one final tip is to be mindful of your tone of voice.
Tone of voice. I've definitely had experiences where someone's tone of voice completely changed the meaning of their words.
It can make a huge difference. Try to speak in a calm, clear, and respectful tone,
Okay?
even when you're feeling stressed or pressured.
Right.
Avoid using jargon or technical terms that the patient might not understand.
Right. It's about meeting them where they are intellectually
Exactly.
and making sure they feel included and informed.
Right. And remember, effective communication isn't just about what you say.
Is
It's about how you say it.
It's about being mindful of all those subtle but powerful cues that shape how our message is received.
Exactly. Now, another key aspect of CCs is assertiveness.
Okay, assertiveness, that can be a tricky one.
It can.
What does it mean to be assertive in a healthcare setting?
Well, it means advocating for your patient's needs,
Okay.
expressing your own thoughts and feelings clearly and respectfully,
Uh-huh.
and setting boundaries when necessary.
So it's about finding that balance between being respectful of others while also standing up for what you believe is right.
Right, and it's not about being aggressive or demanding.
Okay?
It's about communicating your message in a confident and direct way,
Uh-huh.
while also being sensitive to the other person's perspective.
So can you give an example of how a nurse might demonstrate assertiveness
Sure.
in a challenging situation?
Let's say you're caring for a patient who's refusing a necessary treatment.
Okay, challenging.
An assertive approach would involve respectfully acknowledging the patient's concerns,
Okay.
explaining the importance of the treatment,
Uh-huh.
and exploring any underlying reasons for their resistance.
So it's about having that open and honest dialogue,
It is.
trying to understand their perspective and work collaboratively to find a solution
Yes.
that meets both their needs and the requirements of their medical care.
Exactly. And if the patient continues to refuse, an assertive nurse would also feel comfortable escalating the situation to a supervisor or another healthcare professional.
So it's about recognizing that you don't have to handle every situation alone
Right.
and that it's okay to seek support and guidance from your team.
Absolutely. Assertiveness is also important when communicating with colleagues.
Okay, with colleagues.
So if you notice a potential error or have a concern about a patient's care,
Yeah,
you should feel comfortable speaking up, even if it means challenging someone with more authority.
that can be hard.
It can, but patient safety should always be the top priority.
Right, of course.
And assertive communication is essential for advocating for your patients and ensuring that they receive the best possible care.
This is also valuable.
Good.
It's really about empowering nurses to communicate effectively, not just with their patients, but within the entire healthcare team.
Right. And remember, developing these C skills takes time and practice.
It does.
It's not something you master overnight.
It's a journey, but even small improvements in your communication can make a huge difference
They can.
in your patients' experiences and your own job satisfaction.
Absolutely. And don't be afraid to seek out resources and support.
Okay?
There are tons of books, articles, workshops, and even online courses that can help you further develop your SIP skills.
So it's about being proactive and recognizing that investing in your communication skills is investing in your career
Yes.
and in the well-being of your patients.
Exactly. Now, one final area we should touch on is cultural sensitivity.
Cultural sensitivity, yes, that's so crucial in today's diverse healthcare landscape. What are some key points nurses should keep in mind when communicating with patients from different cultural backgrounds?
Well, the first step is acknowledging that cultural differences exist
Okay?
and that these differences can influence communication styles,
Right.
healthcare beliefs, and even how people experience illness and pain.
So it's about recognizing that your own cultural lens isn't the only way of seeing the world.
Right? And it's important to approach each patient with a sense of curiosity and respect.
Okay?
Ask open-ended questions about their beliefs and practices related to healthcare,
Uh-huh.
and be mindful of any potential language barriers.
So it's about being willing to step outside your comfort zone and learn from your patients.
Exactly. And remember, cultural sensitivity isn't about memorizing a set of rules or stereotypes about different cultures.
Right.
It's about being present, listening attentively, and being open to understanding the individual in front of you.
So it's about approaching Each interaction with empathy and humility,
Yes.
recognizing that everyone has their own unique story and perspective,
Right. And it's also about being aware of your own biases and assumptions.
biases and assumptions.
We all have them, and it's important to acknowledge them so
Yeah.
that we don't let them unconsciously influence our interactions with patients.
So it's about that ongoing self-reflection we've been talking
Yeah,
about.
it is.
It's about continually checking in with yourself
Yeah,
and making sure your communication is aligned with your values and your commitment to providing compassionate care.
exactly. And if you're ever unsure about something,
Yeah.
don't be afraid to ask for clarification or to seek guidance from a colleague or mentor.
Okay.
There are also tons of resources available online and through professional organizations
Uh-huh.
that can help you learn more about different cultures and how to communicate effectively in diverse healthcare settings.
It's about being proactive and seeking out that knowledge and support to ensure you're providing the best possible care for all of your patients.
Absolutely. And I think it's important to emphasize that cultural sensitivity isn't just about avoiding offense.
Right.
It's about creating a space where patients feel safe, understood, and respected.
It's about fostering trust and rapport, which is essential for effective communication
Exactly.
and positive health outcomes.
Right. When patients feel comfortable sharing their concerns and asking questions,
Uh-huh.
they're more likely to actively participate in their care and adhere to treatment plans.
It's about empowering patients to be active partners in their own health journey.
Exactly. And that ultimately leads to better outcomes and more satisfying experiences for both the patient and the nurse.
It's a win-win. So we've talked about self-awareness, active listening, empathy, assertiveness, and cultural sensitivity.
We have.
It sounds like all these skills work together to create a holistic approach to SEEPs.
They do, and it's important to remember that communication is a complex process
It is.
that involves both verbal and nonverbal cues,
Right.
emotional awareness, and an understanding of the broader context of the healthcare setting.
So it's not just about what you say.
Right.
It's about how you say it, how you show up,
Yes.
and how you create a space for open and honest dialogue.
Exactly. And I think it's important to acknowledge that communication isn't always easy.
Yeah,
There are going to be times when miscommunications occur, when conflicts arise,
of course.
and when you feel like you just didn't connect with a patient the way you hoped.
Right. It's like any relationship, there are going to be bumps in the road.
There are
The key is to learn from those experiences
absolutely.
and to keep striving to improve your communication skills.
Exactly. And that brings us back to the importance of self-reflection
Yeah,
and continuous learning.
always learning.
Take the time to analyze your interactions with patients,
Okay.
to identify areas where you can improve,
Uh-huh.
and to seek out feedback from colleagues and mentors.
It's about being proactive and recognizing that developing your CO skills is an ongoing process.
Absolutely. And don't be afraid to experiment with different approaches and techniques.
Okay.
What works for one patient might not work for another.
Right.
So it's important to be flexible and adaptable in your communication style.
So it's about being a lifelong learner,
Yes.
constantly seeking out new ways to connect with your patients and provide compassionate care.
Exactly. And remember, even small improvements in your communication can make a huge difference
They can.
in your patient's experiences and your own job satisfaction. It really is. And at the end of the day, that's what makes nursing such a rewarding profession.
It is.
You have the opportunity to make a real difference in people's lives.
Yeah.
And strong Sikh skills are essential for achieving that.
It's true. When you can connect with patients on that human level, it elevates the entire care experience.
It does.
It's no longer just about tasks and treatments. It's about building a relationship based on trust, empathy, and mutual respect.
And that's what this whole deep dive has been about, right?
Yeah,
Helping you, the listener, to refine your communication and interpersonal skills so that you can provide the best possible care to your patients.
absolutely. So let's recap some of the key takeaways from our exploration of seats in nursing.
Okay.
What have we learned?
First and foremost, remember that SEEPs is about so much more than just words.
Okay.
It's about empathy, respect, a genuine connection,
Right.
and seeing the whole person behind the illness.
The whole person.
Yes, it's about recognizing that every interaction is influenced by a complex web of factors,
Yeah.
from individual emotions to cultural backgrounds
Oh.
to the systems and structures of healthcare itself.
We've also learned that nurses need to be incredibly attuned to the emotional context of communication,
Yes,
a patient's anxiety, fear, past experiences, cultural background.
absolutely.
All of these things can impact how they receive and process information.
And we can't forget the impact of organizational structures and cultures.
True.
Sometimes the very systems designed to deliver care can create barriers to effective communication and compassionate care.
Right.
It's important to be aware of those dynamics
Absolutely.
and to advocate for more human-centered approaches within your workplace.
It's like we need to be change agents,
Yes,
constantly pushing for improvements that benefit both patients and healthcare providers.
absolutely. And finally, we've talked about the importance of lifelong learning when it comes to Sikhs.
Lifelong learning.
It's a journey, not a destination.
It's a journey.
There's always room for growth,
Right.
and there are tons of resources available to support you along the way.
So whether you're a seasoned nurse or just starting out,
Yes,
there's always something new to learn and new ways to refine your communication skills.
absolutely.
And the beauty of it is that even small improvements can have a ripple effect,
They can.
creating more positive experiences for your patients and enhancing your own professional fulfillment.
Absolutely. So, as we wrap up this deep dive, I'd like to leave you with a final thought-provoking question.
Okay, I'm all ears.
Knowing what you know now about the power and complexity of seasides in Nurseal, what one small step can you take today to enhance your communication and build stronger relationships with your patients?
Hmm,
What action, no matter how small, will you commit to implementing in your practice?
it's a great question to ponder.
Remember, even the smallest changes can have a profound impact. Keep learning, keep growing, and keep striving to be the best communicator and advocate you can be. Your patients will thank you for it.
And on that note, we'll wrap up this deep dive into CIPS and nursing. We hope you found this exploration insightful and that you feel inspired to further develop your communication skills and create even more meaningful connections with your patients. Until next time, keep learning and keep caring.